Good afternoon. My name is Evangelina Gil Castro. I will be talking about schedules of reinforcement. Some of the schedules of reinforcement that I will go over are variable interval reinforcement, but I will also talk about RSS, which is technically not a schedule of reinforcement, but it is an assessment tool designed to identify stimuli that can be personally reinforcing for an individual, which then can tie into the schedules of reinforcement. Okay, let's get started. Variable interval reinforcement schedules. VI reinforcement schedules are when you deliver the reinforcer at random intervals at different times. This is so that the person you are trying to reinforce does not expect the reward so that they can stay on the desired behavior. This type of reinforcement works because the person being reinforced doesn't know when they will receive the reward. They just know that if they do the desired behavior, they have a chance at getting the reward, and this helps with changing behaviors to whatever desired behavior you are trying to achieve. VI reinforcement schedules work mostly with behaviors that are constant. So, VI reinforcement needs some sort of consistency. For example, staying seated or paying attention are two tasks that work great for variable interval reinforcing. Now, let's look at VI reinforcement schedules in the classroom setting. In the article that I will be mentioning, one of the teachers uses a token system with a timer that chimes at random intervals. When the chime sounds, the students can earn tokens if they are engaged in the tasks. Some examples of the tasks were sitting in their seats or working quietly. This works with the VI definition because it is at random and only the child's performing the desired tasks get rewarded. Another example, which still used a chime, was that students would receive a token if they were seated at the moment that the chimes sound. I do, however, see an issue with this because if the students are moving out of their seats, it could be a little more likely to disturb the classroom. Another way that VI works in the classroom setting is positive peer interactions, where a teacher randomly reminds the entire class to ignore off task behaviors by peers, and then the reinforcement is delivered when the class as a whole demonstrates the desired behavior, which encourages a supportive classroom environment. Teachers can also use VI as a self monitoring tool. This They could use this as a reminder to provide specific praise to students at random intervals. This helps the teachers increase positive reinforcement for the whole classroom, which overall enhances the positive climate without requiring a constant mental tracking of when to deliver the praise. Now let's take a look at IV reinforcements after extinction. Because there is a steady increase in positive behaviors and a decrease in problematic behaviors in the classroom setting, there is more of a chance that the children will maintain the desired behavior even when the reinforcer has stopped. The success rate of IV reinforcement tends to be higher even when the reinforcement is extinct, and the IV reinforcement schedules would encourage and help students maintain desired behaviors by reinforcing them at random times so that when the reinforcers are removed, they can still stay on task. Okay, now let's look at reinforcement survey schedules. RSS is a behavioral assessment tool. This tool was designed to help individuals find what they think is an enjoyable or a reinforcing thing that can then be used to help modify their behaviors. This tool has claimed to be very reliable and valid for identifying reinforcers that can effectively influence and modify behavior. The RSS would show internal consistency and stability over time, meaning that individuals would consistently rate the reinforcing value of certain stimuli in similar ways across different administrations, which means that the RSS tends to be a reliable tool. For the validity, items rated as very much or much reinforcing on the RSS would function as effective reinforcers in real world applications, meaning that these items would lead to measurable increases in the behavior they were intended to reinforce. Some of the limitations that come from the RSS are the or is the self-report bias. The RSS relies on self-reporting rates of what individuals find reinforcing. Self-reporting can be prone to biases, including social desirability bias, where individuals may rate certain items favorably to align with social norms, and with doing that, it provides some inaccuracy in the self-assessment. Okay, let's look at RSS among populations. The first population that we're going to talk about is alcoholics. One study involved a sample of individuals with alcohol dependency to assess the internal consistency of RSS responses, particularly correlating much and very much rated items to reinforce them across sections. That is one way that it could be used with that population. With undergrad students, another real reliability study used a large sample of 111 male and 202 female undergrad students, with a subset of 118 students followed over multiple weeks to assess test retest reliability. This group rated the reinforcing value of 140 items over intervals of 1, 3, and 5 weeks. When looking at schizophrenic patients, a replication study used a sample of hospitalized patients diagnosed with schizophrenia, applying the RSS and covert reinforcement methods to test the tool's validity and effectiveness in a psychiatric setting. When looking at depressed individuals and other clinical populations, additional studies referenced in the article involved individuals who self identified as depressed, comparing their RSS responses to those of non depressed individuals to explore the relationship between depression and reinforcement availability. So, that was how you could use RSS among these various populations mentioned here. Now, let's take a look at RSS applications. Clinically, it can be used in various therapeutic approaches, including enhancing reinforcement during therapy sessions, identifying reinforcements for behavior modification in institutional settings like hospitals. Institutionally, RSS aids in developing individualized treatment plans, supporting token economy programs, and matching staff patient reinforcements. With research, RSS can reveal behavioral insights across populations. An example of this could be the preferences between juvenile offenders and non offenders. Now let's take a look at reinforcer sampling. Reinforcer sampling is a technique that would briefly expose an individual to a sample reinforcing activity before they had to pay a token to unlock the whole activity per se. In the study that I will be referencing, reinforcement sampling resembles a fixed time schedule of reinforcement, but with a slight modification. In typical reinforcement schedules, a response must occur before reinforcement is given, and in this case, no re- no response is required for the initial exposure. For the purpose of reinforcer sampling is that it aims to familiarize or refamiliarize individuals with the reinforcer to encourage participation, especially in cases where the individual might show little interest or awareness of the reinforcer's value. Some of the applications are that it is particularly useful in a clinical or therapeutical setting, such as patients in mental health facilities, children in educational settings, or groups who may benefit from increased motivation to engage in positive reinforcing activities. Some potential limitations are There's a huge potential for satiation, and the overuse of sampling might reduce interest in individuals where they feel like they already know the reinforcer. Let's talk about the application of reinforcer sampling to patients in a ward. Um, in the article that I read, they went through three phases. Phase one was a baseline, no sampling. This was to establish participation rates for each activity, which were walks, music sessions, and movies. Phase two was a reinforcer sampling intervention to determine whether brief required exposure to reinforcing activity would increase. And phase three was a return to baseline, no sampling, to assess whether the increasing engagement seen in the sampling phase would persist after the intervention was removed, testing the lasting effect of sampling. Now let's take a look at the procedure of the phases. In phase one, patients were informed of the available activities and could choose to participate by exchanging tokens, but they were not required to sample the activities first. In phase two, patients were required to sample each activity briefly before deciding if they wanted to engage fully by using a token. For example, walks, patients were asked to stand outside briefly to experience the environment before deciding whether to go on a full walk or not. In phase three, the sampling requirement was discontinued, reverting to the initial baseline conditions where patients could participate if they wished without a required preview. In conclusion, the study found that the reinforcer sampling is an effective technique for increasing participation and reinforcing activities among mental health patients. These are the three articles that I referenced throughout the presentation. You can see their DOI number here if you're interested in looking any of those up. And with that comes the end of my presentation on schedules of reinforcement. Thank you for listening.